So by now we know that autism is a neurodevelopmental disorder where the individual's social skills or communication is affected with repeated or restrictive behavior. So talking about interventions, that means talking about the treatment base that we have for the autism affected individuals, right? So first and foremost is ABA, that is called Applied Behavior Analysis Therapy, which is the most widely used therapy, which is evidence based, wherein the focus is to reduce the unwanted behavior and reinforce the behavior that we are actually wanting from the individual to behave. So with some reinforcements, positive reinforcements, we focus on getting the behavior that we want from the individual to behave in a certain manner, or reward them for those kind of behaviors that are actually wanted from them. Second is, like we said, that the individual is affected with their social skills. So the second is social skill training, wherein we teach the individual who is affected with autism to have meaningful communication, to have meaningful friendships, how to maintain a communication while they start a communication with others. So this basically focuses on training them how to behave in a social environment around them. Now third is actually occupational therapy, as people put it, or we also call it as sensory therapy, wherein we know that individuals with autism do have problem with sensory issues like loud noises or some kind of a texture or any kind of emotional regulation. So this therapy focuses on how to sensitize them towards these kinds of irritants that they feel that they are. Fourth would be speech and language. Now that we know that autism does affect the speech, social communication, language of an individual. So this focuses on how to say certain words, how to have a meaningful sentence said out by an individual. So this is more in a severe case, but also speech and language therapy is very, very effective with individuals with autism. Now we've spoken about how we can benefit or how we can help the individual with autism. With that, I also feel parents of individuals with autism are very, very affected, and they do suffer from burnout. So a lot of focus is not kept on them. So another thing that we can add in intervention or treatment is to have support groups for the family, to have parent counseling as well. That is very, very important, how to take care of themselves while taking care of the individual with autism. Another thing that can help with individuals with autism is meditation. A lot of us do not focus on meditation with individuals with autism, that it can actually calm them down, it can actually regulate their emotions, it can actually make them more self-aware. With growing age and with the autism in elders, another factor that is brought into our notice or is a severe concern by the parents is social skills. How will they earn? Will they ever get married or not? Will they ever lead a normal life or not? So another point, which is the sixth point, is that we can actually work on social skill trainings as well. So these are the few intervention techniques that we've mentioned. So this can be taken individually as per the concerns of the client, or this can be taken collaboratively as per the severity and the concerns of the individual with autism.